the Skill Council for Persons with Disabilities, in collaboration with the Department of Social Security and Empowerment of Persons with Disabilities, Government of Odisha, and NAB India Centre for Blind Women, organized a national seminar titled Samavesh 2025 in Bhubaneswar. The seminar aimed to promote the inclusion of visually impaired individuals in the workforce and enhance their financial independence. The event was inaugurated by the Honorable Minister of Industries, Skill Development and Technical Education of Government of Odisha, Shri Sampath Chandra Swain.
Today we gather not just for a meeting, but to reaffirm our commitment to ensure that every person, regardless of ability, has a rightful place in our workforce and contributes to the growth of our state and nation. As we work towards a Samruddh Odisha by 2036, in line with the national vision of Viksit Bharat by 2047, we must ensure that no one is left behind. Skills bring empowerment, and for our differently abled friends, skills help them achieve their dreams. But skills alone are not enough. We need acceptance, opportunities, and true inclusion. The industry plays a crucial role in creating an inclusive society. It is time for industries to recognize and actively support the talents of differently abled individuals, including those who are visually impaired. Across sectors like IT, manufacturing, hospitality, and entrepreneurship, we have seen inspiring examples of persons with disability excelling. Their skills and determination set an example for all of us. I sincerely thank companies like Taj Hotels, Spark Minda, Medant Hospital, and Amazon India for leading the way in hiring visually impaired individuals. Your commitment to inclusivity is truly commendable and should inspire others. I also appreciate the Skill Council for Persons with Disabilities, which in collaboration with the SSEPD Department, Odisha, and the NAB India Centre for Blind Women has trained 100 youth in different job roles such as customer care executive, warehouse packers, assistant spa therapist, and medical tactile examiner. This is a significant step towards sustainable employment for persons with disabilities.
Several discussions were held between the various stakeholders of the industry during the seminar to understand the inclusion process of visually impaired into diverse fields through skill development.
This is the stage just for my visually impaired friends. अगर आपको देखने में मतलब पता न लगे क्योंकि माइक बड़ा कंफ्यूजिंग होता है तो मैं यहाँ प्लेस हूँ, हमारा पैनल यहाँ प्लेस है.
So now I will talk on the mic. Thank you so much. बहुत दिक्कत होती है. You see, हम लोग आई कांटेक्ट बनाना चाहते हैं और अब हमारा तरीका आई कांटेक्ट बनाने का यही है कि हम जिस डायरेक्शन से आवाज़ आ रही है उस डायरेक्शन में फेस करते हैं.
In India, breast cancer cases have been on the rise in the past few decades, as has been in the West as well. There is no proper screening program in the community for breast cancer. Screening means to be able to detect cancer before it becomes obvious in the form of symptoms. In India, sadly, still about 80 to 90% patients present in late stages. And we struggle with getting our women to come early. And there are so many barriers that prevent women from coming early. So we have to look at options which work for India. In the West, screening mammograms are done in the community, routinely from a certain age onwards. But that is not the solution for the problem in India because of a lot of reasons which I won't get into right now. But when I came across this very novel program 8 years ago, Shalini and me went to Germany, and I must say I had all my reservations thinking, how can a program like this be successful? But when we saw these girls at work in Dr. Frank Hoffman Center, and then in Berlin, we visited a center that was purely run by visually impaired tactile examiners. It really got us thinking that can we bring this program to India? So NAB plays the great role of training these girls on how to become self-sufficient. So the first question for any person who is going to employ somebody like this is, will they be able to find their way around the workplace? And if you're coming to a clinic where there are already patients whose anxieties are heightened because they are worried they may have a disease, how are they going to react to a visually impaired person? So the first batch of interns who came, and Neha was one of them, I must say they do 3 months of hands-on training with me in my clinic. I couldn't get the courage to ask a patient, would it be okay for you to be examined by someone who's physically impaired? Because as everybody was talking, the problem was in my mind. The disability was in my mind. And then a very smart young lawyer girl who was all of 25 walked into my clinic, and I gathered the courage to ask her. She got herself examined. She was so impressed. She went outside in my clinic and told all the patients who were waiting about this wonderful girl who was visually impaired, and examined her inside. And that was just the beginning. And we've had a wonderful stint training these girls.
Tactile sensation by visually impaired open is the best technique. I have already spoken to some of the government officials. The previous health secretary was known to me, Mr. Chandra, Apurva Chandra. I have spoken to him, but the question is, before, we don't have a lot of budget in health and all that, but this can certainly be done. And I advise everybody that everybody must get the examination after the age of 30 by a visually impaired woman, because their sensation is much more accurate. टैक्टाइल सेंसर, भगवान एक काम करता है, भगवान एक चीज बंद कर देता है, दूसरा आदमी बहुत खोल देता है. तो इसलिए ये करना बहुत जरूरी है.
This program might bring the women to a doctor's door much earlier so that they can survive. There are more survivors. And actually, sir, answering your question, when they come to you in the stage 3, the treatment cost is much, much more. But when a girl can figure her out in stage 1, when a breast screening happens by a medical tactile examiner, that pencil's back is the smallest lump that she can figure out, 0.5 centimeter. But when people come to you with their lumps identified by themselves, they have already reached a whole ball size, tennis ball size. And you know that it's already stage 3 or stage 4. The treatment takes much more money. But in the first stage, the treatment, I'm sure, takes much less money, it's much less painful, and it's also much less traumatic for the woman. So we hope that the program sees a bright future in Orissa ahead, with doctors like you sitting here and taking interest. We are definitely hopeful that it is going to serve its two-pronged purpose. It's going to be enriching and empowering for the lakhs of blind women in Orissa, that they get a role in the society and they get a role in the whole mainstream, and the lakhs of women who are suffering with breast cancer also get addressed.
There are multiple complexities in skilling of persons with disability. First, they are amongst the poorest of the population, socially excluded minority, poor to nil education wherever the formal education certificate exists. The actual education or the learning has still not been translated into the learning outcomes. The population is scattered with reference to a specific disability in a geography and in small numbers. There is lack of involvement of private sector in skilling of persons with disability. The skill ecosystem predominantly works as a business model, where it strives to make money by doing the good job that they are doing. And they obviously lack a huge understanding as to how to handle the skilling for the persons with disability. On the other hand, you have NGOs who are willing to do this job, but they lack the ability to skill as it is required by the industry. It's just a dichotomy that exists in the ecosystem. There's a lack of involvement of private sector in skilling of persons with disability, very low access of training in rural areas. Predominant training centers you'll find as urban centers. I talk to large corporates, CSR karega, Bangalore, Delhi, Chennai. I talk about Yavatmal, we don't have any presence there. But the diaspora is there, that needs to be addressed. So that's a constant fight that we are fighting. We are very fortunate that some organizations are now learning to work on those lines. And the government is also very supportive on that. We just finished a brilliant program under the World Bank aegis called the Sankalp Initiative. We trained 2,200 people and it has been rolled out absolutely on track.
The Samavesh seminar also highlighted the importance of equipping visually impaired individuals with skills aligned to current market demands.
हम जो दो स्पेसिफिक चीज़ देखते हैं, वन इज़ द डिमांड फॉर स्किलिंग इन द इंडस्ट्री एंड सेकेंड इज़ द अवेलेबिलिटी ऑफ ट्रेनर्स. जैसे फॉर एग्जांपल हमारे पास एक ट्रेनिंग प्रोवाइडर हैं जो रायगढ़ जिला में पैकर्स का ट्रेनिंग प्रोवाइड करते हैं फॉर PWDs, और एक हमारा अभी गजपति में शुरू हुआ है. उड़ीसा में 30 ज़िले हैं, तो 2 बैच हम लोगों ने रायगढ़ में किया तब. तो हमारे ये बच्चे प्लेस्ड हुए थे फर्स्ट क्राई में. सो इंडस्ट्रीज़ भी ग्रेजुअली आगे आ रही है. सो पैकेजिंग का एक हम ट्रेड देखते हैं जिसमें काफ़ी ज़्यादा एम्प्लॉयमेंट की संभावना है. इनफैक्ट जो अभी जो प्रोग्राम SC से सेक्टर स्किल काउंसिल फॉर PWD ने किया है, उसमें एक पैकर का भी ट्रेड है. तो हम डिफरेंट ज़िले में हमारे स्किल डेवलपमेंट सेंटर्स हैं. हम कोशिश करते हैं कि हम मोर एंड मोर ट्रेनिंग पार्टनर्स अवेलेबल करा पाएँ. एक सेक्टर स्किल माध्यम के थ्रू हो सकता है, डिफरेंट ट्रेनिंग प्रोवाइडर्स जो इंटरेस्टेड है उनके माध्यम से हो सकता है, एवं इंडस्ट्री अगर डायरेक्टली करना चाहे उनके माध्यम से भी हो सकता है. एक ओडिशा एसोसिएशन ऑफ ब्लाइंड के साथ हमारा ट्रेनिंग प्रोग्राम भी हुआ था, एक छोटा सा ट्रेनिंग प्रोग्राम हुआ था. और अभी हम एक जेम्स एंड ज्वेलरी सेक्टर स्किल काउंसिल के साथ हमारी बातचीत चल रही है, उनके लिए एक ट्रेनिंग प्रोग्राम डिज़ाइन करने के लिए. तो हमारा कोशिश रहता है कि कैसे हम मोर एंड मोर ट्रेनिंग प्रोवाइडर ला सकें. ट्रेनिंग प्रोवाइडर के साथ एक चैलेंज रहता है कि ट्रेनर्स को ट्रेन करने का जो TOTs होता है उसके लिए जो स्पेशलाइज्ड डोमेन ट्रेनिंग चाहिए, वो एक चैलेंज हमारे पास हमेशा है. उसको हम ओवरकम करने की कोशिश करते हैं. उसके बाद ट्रेनिंग के बाद जहाँ पे कैप्टिव प्लेसमेंट हो जाता है, उनका किसी भी इंडस्ट्री में जाना रहना, टू गेट देम इंक्लूसिव, ये एक पाथवे हम क्रिएट करने की कोशिश कर रहे हैं.
Actually, in our department, this department was set up 10 years ago for creating job opportunity, career opportunity, along with education and other needs of PWD people. So we are taking up this in this department various schemes, various career training for our PWDs, hearing impaired people and visually impaired people, and somehow we have been successful in a way. But as you are saying, the gaps, yes, gaps are there because we are not reaching to the interior sectors of the state. Now, the main concentration is in the Bhubaneswar, Puri, Cuttack sector, and mainly in coastal areas. So we have to explore the opportunity of skill training for PWDs in all the districts of Odisha, and yes, there is a gap.
आसन तुम सिकी निर्माण करे बाल करो संसार कारो खाना है यू की व्यवसाय भिन्नक्षमा व्यक्तिं खुदेवा अंतर्भुक्तीकरणर समान अधिकार स्वप्न रहे उच्च उड़ाणो एवं देखी संभव है आसारे भरा सुनेली सकड़ा एबे बंची है प्रतिदिन एबे बंची है प्रतिदिन